we don't see these subsidies come into play, what we're going to be seeing is a couple who's 60 years old, earning $80,000 a year, paying $30,000 for their insurance premiums. So I'm just glad we're starting to talk about it. I think it's pretty concerning that we're going to see this pushed again and again. I think it shows that, frankly, we haven't been engaging with this on a really serious basis. Like, what we haven't been talking about is why are costs in this country so high and what we can do about them.
Why are they so high?
It's the prices. And I think that's been this sort of real backdrop to the subsidy debate. What we've really been talking about is how you subsidize health insurance. It's like saying, if a hamburger was $300, how do we subsidize it? What we're not talking about is why the hamburger is $300 in the first place. So we've really never had bipartisan, serious conversations about the cost of healthcare. And one of the challenges is another way to talk about healthcare spending is to say it's $1 of somebody's income that's out there. And we're not good at doing government interventions, introducing policies that make a whole lot of folks better but might take away income from other folks who are out there in the country.
Yeah. And so in terms of trying to actually put into place policies that would make things better for people out there, Americans, that would drive down their cost, what might some of those be?
So we need more competition in healthcare. One of the things that's happening nationwide is hospitals buying up other hospitals, and that's raising the price of care. We see hospitals buying up physicians. It's raising the price of care. We see a lot of stuff happening with pharmacy benefits managers. It doesn't bring benefits to patients, but it makes care more expensive. Those are the types of conversations we need to have. We need to be subsidizing insurance. I think that's going to get folks coverage. It's going to allow us to have those bigger conversations about healthcare spending. But we really need to be talking about the root causes of rising costs right now.
So it sounds like, from what you're saying, as someone who studies this whole system, that first you essentially have to continue to subsidize because the price is what it is at this point, and it's too high for many Americans out there. And then after you've done that, then you need to really get in there if you're Congress and the president and actually make some real changes to the system to include more competition and ways to bring down the prices.
That's exactly right, Jessica.